Hello everyone, I am Dr. Sunali and today we are going to talk about ELISA. ELISA is a very important topic. It can come as a short note, as a long question, and you can get lots of MCQs also from this topic. Now let's start. ELISA is an antigen-antibody reaction, just like your precipitation or agglutination. Okay. Now ELISA, the method of ELISA is like a detective trying to find hidden antigen or antibody in a patient's serum sample after putting that serum sample in the well of this microtiter plate. Now this is what we are going to understand today. So ELISA stands for Enzyme-Linked Immunosorbent Assay. Okay, the whole process of this ELISA takes place in this microtiter plate. Okay, this is a detachable microtiter plate, and this microtiter plate has 8 wells here and 12 wells here, making it a total 96 well microtiter plate. Okay, now you see each well of this microtiter plate holds one sample from one patient. So we can put many serum samples from different patient at once. Okay. Now there is the property of this microtiter plate that it is covered by a layer of a immunosorbent material. Immunosorbent material like your polyvinyl and polystyrene. Clear? Now, what do you mean by this? What do you understand by this? That it is covered by a layer of immunosorbent material. Well, I'll explain you. Think of it as the well of the ELISA plate covered by a layer of lox. Okay? It is covered by a layer of lox. So, when you add antigen or antibody on it, it gets fixed on this lox. Okay? It gets fixed so that even when you are washing this plate, this antigen or antibody which is fixed on these logs won't get washed away. ये धुलने के भी बाद नहीं जाएगा because of adsorption. It get adsorbed on the surface of the wells. Okay. Now understand, absorption का मतलब होता है समा जाना, adsorption का मतलब होता है to get stuck on the surface. Okay. That is adsorption. So here we have adsorption. Clear? This is known as immunosorbent material. Now, in your first year biochemistry, you must have read about enzyme. So, if you can recall that, you can think that enzyme reacts with a substrate. Now, this reaction of enzyme and substrate will do what? It will activate a chromogen. Okay? It will activate a chromogen to do what? To produce color. Okay. Now, this information is going to come very handy for us with understanding the principle of ELISA. So, enzyme reacts with substrate which activates this reaction of enzyme and substrate, activates chromogen to produce a color. Now, the name of enzyme, substrate and chromogen which you should remember is enzyme is a very common enzyme used is horse radish peroxidase, HRP. Okay. Peroxidase. So, if enzyme is peroxidase, your substrate will be hydrogen peroxidase, H2O2. And chromogen here is tetra-methyl-benzidine. This is the name which you have to remember. Okay. Now, in your ELISA, enzyme is linked. Your enzyme is linked to an antibody. Okay. This is the enzyme. This enzyme bulb is the enzyme. Okay, linked to an antibody. So, when you add a drop of this substrate chromogen complex on this bulb, what happens? The enzyme reacts with the substrate and the reaction activates chromogen. So, what will happen at the end? A color will be produced. Okay, this is what happens in ELISA, the color. It is the final step, it is the final result. What we see is the color in ELISA. Okay, so this is how the final result of ELISA looks like. You see, every well has a sample, serum sample from different patient. We have added the serum sample and we have added various buffers, and then we have added the enzyme labeled antibody, and then we have added substrate, chromogen, lots of things we have added, and this is the final result. Now you see what is different in this whole well. For each patient sample, there is something different. The difference is in the intensity of color. Okay, intensity of color is different. Sorry, the intensity of color is different. Now you have to understand why. because intensity of color is directly proportional to the amount of target molecule, amount of target molecule present in the patient serum. What is our target molecule? It is the antigen or antibody, whatever you are trying to find in that patient sample. So see it like this. I'll take this well. This well has a very dark color result. So if this well, that means this patient sample, the well in the sample in the well, this sample have lots of antigen and antibody, whatever I'm trying to find, antigen or antibody. Okay. So what will happen because of this? If it has more antigen or antibody, then more enzyme linked antibody, more of enzyme linked antibody will come and get attached to this. Okay. And because of that, when we add a drop of substrate chromogen, it will produce a very dark color. Clear? Okay. Now we will see a different well. We will see this well, which is lighter in color. So the sample put in this well has fewer antigen or antibody, whatever we are trying to find. So as a result, what will happen is, if it has fewer antigen or antibody, then less enzyme linked antibody will be binding to it. That means when we add a drop of substrate chromogen, the color which is produced is lighter. Okay, because less enzyme linked antibody has been linked, has binded to this. So the color, overall color which is produced is very lighter, but here it was darker. Okay. Till now, whatever I have told you is the principle of ELISA. Clear? Now we will move. So, the whole intensity of color, we can't see it with our naked eye. It's very subjective. So we measure it with this spectrophotometer. Okay, this is the machine which gives us the final result of ELISA. Clear? Now, this was everything about the principle. And now we will see the types of ELISA. Now we have various types of ELISA. Out of everything, your direct ELISA, your sandwich ELISA, and your competitive ELISA. In that, we are looking for antigen in the patient's serum. Okay. But for your indirect ELISA and your capture ELISA, we are looking for antibody in the patient's serum. Okay. We will look at each one of them individually. Now let's start. Talking about direct ELISA. Now I have a patient who I'm suspecting to have AIDS. Okay. So I directly want to see what is causing this AIDS. What is the causative agent of AIDS? HIV virus. It's caused by HIV. Now, when I am directly looking for the antigen on the surface of the virus, what is making my patient sick? I'll use direct ELISA. Okay. So what I'll do is I will take a microtiter plate. Okay. This microtiter plate is covered by a layer of your immunosorbent material, biologs, like the one I have explained. Now, I will apply my patient sample, serum sample. After that, what will happen? The antigen which is there, the HIV antigen which is there will come and get fixed on these logs. It will get adsorbed. Okay. Now, once it has gotten adsorbed, what I'll do? So you see, after every steps of ELISA, we have to wash the plates. Okay, I won't mention that every time, but just remember, after every step, we wash the plate so that anything which has not been binded together can get, to get washed off, so that it won't interfere with the result. Okay, so I won't be telling it every time that I'm washing the plate, but it's a unsaid thing that after every step, we will wash the plate. Okay, so after that, what I'll do is I will add a enzyme labeled primary antibody. Now, why is this primary antibody? Because you see, this is antibody directly attaching with the antigen. Okay, so it is a enzyme labeled primary antibody. After that, what I'll do is I'll add a drop of substrate chromogen complex, and after the reaction and the activation of chromogen, a color is produced. This is your direct ELISA. Everything is direct. So what is happening? I am taking a microtiter plate. Okay, a microtiter plate covered with a immunosorbent material. Then I'll add the patient's sample having the antigen. And after that, I'll add this primary antibody conjugated with an enzyme. and then I'll add my substrate chromogen complex and the color is produced. This is direct ELISA. Clear? Now let's move ahead. We have indirect ELISA. Now indirect ELISA is like detecting antibody in the serum. I am detecting not antigen here, I am detecting antibody in the serum. Now if again I'll take my patient with AIDS, okay. Now the antibody will be produced again, what will be produced against the HIV antigen, right? So what I'll do here is I will take a microtiter plate which is already pre-coated with the HIV antigen. Okay, this is available commercially. I'll take a pre-coated plate with the antigen for whatever disease whatever infection I'm trying to find the antibody with that particular antigen. I will pre-coat my plate with. Now since here I'm looking for AIDS, so I have pre-coated my wells with the layer of the immunosorbent material. I have pre-coated it with the antigen, HIV antigen. Now after this, when I add my serum sample, what will happen? The antibody, the patient's antibody will go and get attached to the antigen here. Okay. Now you see I need an enzyme labeled antibody also, but here since this antibody is coming from the patient, there is no way I can attach it with an enzyme. So I will take another antibody attached with enzyme. Okay, so like in direct ELISA, we directly took the patient sample and then we added the primary enzyme labeled antibody. Only 2 steps. Here there is one more additional step, that is adding a enzyme linked secondary antibody. A secondary antibody which is enzyme linked. Why is it secondary? Because this antibody is coming and getting attached to the primary antibody. Clear? And also since this antibody is directed towards a human antibody, okay, this is from the patient serum, this is patient's antibody. So this is also known as anti-human immunoglobulin. Clear? Now when I add my drop of substrate chromogen, the reaction will happen and a color will be produced. This is indirect ELISA. Now you see the indirect ELISA, what is happening? I am taking a well pre-coated with an antigen. Pre-coated well with antigen. Then I add my patient's serum sample. For the antibody which I am looking, if the patient has the antibody, it will come and bind with the antigen. Then I'll add a secondary antibody conjugated with an enzyme, and then when I add my drop of substrate chromogen complex, a color is produced. Okay, this is indirect ELISA. Now talking about all these ELISAs have made me really hungry. So let's make a sandwich. Let's talk about sandwich ELISA. Now why is it called a sandwich ELISA? Because we are putting antigen between 2 layers of antibody. Okay, like how we put our veggies in between 2 layers of bread, the same way we are detecting antigen here by putting it between 2 layers of antibody. Okay, that is sandwich ELISA. What are we detecting? We are detecting the antigen. So if I am detecting, I have to detect antigen. So what I should pre-coat my well of that microtiter plate with? I will pre-coat it with an antibody. Okay, now this is the capture antibody, okay, that I have pre-coated on the microtiter well. This is also available commercially. Now this is called capture antibody because its function is to catch or capture the antigen in the patient serum. Okay, that's why it's called capture antibody. This is the first layer of my sandwich, capture antibody. After that, what I'll do? I will put my patient serum. That is the antigen present will come and bind to it. This is the patient serum sample, my first layer of veggie. Now this is a very simple sandwich. Okay, I don't want it to make much fancy. So I will now add another layer of blood. Now this is the detector antibody. Okay, detector antibody which is enzyme linked. Now this is called detector because due to this antibody we are getting to know whether the antigen is there or not. So first is the capture antibody and second is the detector antibody, and this is your sandwich ELISA. So what is happening here? We are taking a microtiter well pre-coated with a capture antibody. Then I am applying patient sample, serum sample. having the antigen. Now I am applying is a detector antibody, enzyme labeled, and then when I add my substrate chromogen complex, color is produced. This is sandwich ELISA. Clear? Now we'll move ahead. Now we have a modification of sandwich ELISA known as IgM antibody capture. Okay, MAC, M antibody capture, MAC ELISA. Now, why do we use this ELISA? Because IgM, your IgM is the first antibody to be raised in an infection. So, if you want to detect an infection in its acute phase, we can go for this IgM antibody capture ELISA. Now, what do doctors do to detect antigen in the acute phase? You know, doctors just write some lab test. Doctors love doing that. We love doing that. Doctors just write some lab test. Now let's see for what all infections, for what all disease you need this IgM antibody capture ELISA. Can do it for dengue. I can do it for Japanese encephalitis, for West Nile virus, okay, for scrub typhus, and your L will stand for leptospirosis. Okay, and what does T stands for? Your T stands for toxoplasmosis. Okay, so these are the important ones. There are many more, but these are the important infections for which we do the IgM antibody capture, MAC ELISA. Okay, now let's move ahead. So what I am trying to find here in the patient's serum sample, I want to find the IgM antibody. Okay, so you tell me now. I am taking my microtiter well. So what I should pre-coat my microtiter well with? Now, if I pre-coat, imagine I am looking for dengue, for the IgM antibody against dengue infection. Okay, against this dengue virus. Now, if I put the antigen of dengue, okay, the virus antigen of this dengue, what is going to happen? Okay, and after that I'll take my patient's serum sample. Okay, now if this patient is positive for dengue, then this will have IgM, but it will also have IgG. This patient's serum sample will also have IgG. Even in the acute phase of infection, they might have IgG because of past exposure to dengue, because of secondary infection or reinfection from dengue, or due to cross reactivity with related virus. Okay, if any related virus infection this patient had, so a cross reactivity can happen. The IgG formed for that virus can come and bind to this antigen. Now I'll get false result. I don't want it to happen. I'm specifically looking for IgM. So what I will do here is I will pre-coat my microtiter well with anti-human IgM. Okay, anti-human IgM antibody. Now, since why? Because I want to capture IgM antibody. So, antibody against this will be anti-human IgM antibody. Clear? Understood why? Because I am eliminating the IgG antibodies. I don't want in the patient sample to talk about IgG at all. I only want to focus on IgM. So, I want to be specific. So, I'll pre-coat it with anti-human IgM antibody. Clear? Now, next, now, you know, as compared to your sandwich ELISA, your MAC ELISA is like making a club sandwich. How? I'll tell you. So, I have my dengue patient here. Okay. So, I have taken the patient sample and I want to see whether IgM antibody is there or not. So, first thing I'll do is I have pre-coated my well with anti-human IgM. This is the first layer of my sandwich. Okay. After that, I'll apply patient serum sample. This is, if the patient have the IgM antibody, it will go and bind to the anti-human IgM. Okay. Now, it's a club sandwich. So, I will apply one more layer. This layer, this is the antigen, the recombinant dengue antigen, which is available commercially. Recombinant dengue antigen. And after that, I will apply my detector antibody, which is enzyme linked. Okay, and after that I will apply my substrate chromogen mixture and it will react and produce a color. This is your MAC-ELISA. I hope you understood. It was a bit tricky as compared to other ELISA. Okay. So let's have a comparison now for your sandwich ELISA, indirect ELISA and MAC-ELISA. So what is quoted on the well of each ELISA? For sandwich ELISA, I had a capture antibody, okay, because I had to capture the antigen. Indirect ELISA, because I want to detect antibody, the well is pre-coated with antigen. And in MAC-ELISA, since I want to specifically target IgM antibody in patient serum, I will pre-coat it with anti-human IgM antibody. Clear? What is detected? Sandwich ELISA, antigen in patient sample. Indirect antibody, both IgM and IgG, but MAC-ELISA, IgM, specific for infection. It is best for sandwich ELISA for detecting antigenemia, the presence of antigen, early phase of infection in sandwich ELISA. Indirect ELISA, we are detecting antibody response, both IgM and IgG. MAC-ELISA, we are detecting IgM in the acute infection, the acute phase of infection. Clear? Advantage, sandwich ELISA has high specificity for detecting antigen. Indirect ELISA is simple and widely used, whereas MAC-ELISA, we don't have IgG interference at all. So it is good for early diagnosis by diagnosing the IgM, the acute phase of infection. Clear? Now we will move ahead to the one that is competitive ELISA. Now this is a bit tricky as compared to the other one. So I have tried my best to explain you. So what we'll do here is, I have taken two scenario, okay. In that I have my patient of AIDS again. I have two patients actually this time, and I am suspecting AIDS in both. So for first sample, first patient is positive for AIDS. They have the HIV antigen. Competitive ELISA is to detect antigen, okay. So the first sample I have taken, the patient is positive for HIV. So the sample will have antigen, okay. Now what I'll do is, before I'm putting this sample in the microtiter well, what I will do is, I will add this, I will take this sample, this patient sample, serum sample, and I will add a antibody. For the antigen which I am detecting for, I will add the antibody and I will combine them together. Okay, I'll put it in a test tube. So the antigen and antibody will bind together. Okay, this is what is happening here. Now I will take a microtiter plate which is already pre-coated with the same antigen. Okay, same antigen which I am looking for. So and then I will, this complex I will put in the well. Now you see what is happening. This antibody has already combined with the antigen from the patient sample. So it won't go and bind with the antigen present in the well. Okay, it's like a competition. Okay, see, think of it like you're going to a party. So that party has many, delicious food, but you have already eaten the same food at home. Now you are full. You can't go and eat the food in the party. So the food in the party will be untouched. Same is happening here. This antibody has already binded with the antigen in the patient sample. So if the same antigen is pre-coated here in the well, it won't be binding. So what happens is, after the washing step, this is not binding to these, so it will get washed away. So when I am adding my enzyme-linked antibody, it has nothing to bind. Okay, the antibody here has been washed away, so that will also get washed away, and at the end what we have is no color produced. Clear? Now I'll take my another sample patient. Now this patient I was suspecting, but the patient doesn't have AIDS. The patient is not positive for HIV. So what I'll do is, I'll again put the patient sample with this antibody. Since this patient sample doesn't have the HIV antigen, what will happen? It won't bind. It will only have the antibody. It won't bind to the antigen. So what happens is, when I take my microtiter well pre-coated with the same antigen, same HIV antigen, and I add this and this complex, but in this complex my serum didn't have the antigen, so the antibody is free to come and bind here. Okay, so if I'm going to a party and I have not eaten at home, so I will go and I will eat the food there, right? So your antibody is binding to the antigen here. After washing, this won't get washed away. Why? Because it had gotten fixed to it. Now, when I add my enzyme labeled antibody, what will happen? And after it will get attached to this antibody. And now, when I add my substrate chromogen complex, a color is produced. Now, why I told it's tricky? It is tricky because you see, when the patient is having that antigen, when the patient is positive, there is no color produced, but the patient is negative, there is color produced. This is competitive ELISA. Okay. In competitive ELISA, intensity of color produced is inversely proportional to amount of target molecule as compared to rest we have seen till now. So that's why this is a bit different and confusing from others. Okay, inversely proportional to amount of target molecule. This is competitive ELISA. Okay, now let's see the all the ELISAs together. In direct ELISA, what we were doing, we were detecting the antigen in the patient serum sample by combining it with a primary enzyme labeled antibody. Okay, enzyme labeled primary antibody, and then we'll add a drop of substrate chromogen complex, color is produced. Now we'll see indirect ELISA. Indirect ELISA, what we were doing, we were taking a antigen coated well. After washing, we were adding specific antibody to be measured, that is the patient's serum sample. After washing, we were adding enzyme conjugated secondary antibody, and which was giving a color. This was your indirect ELISA. Then we had sandwich ELISA. For sandwich ELISA is the antigen trapped between two antibody, the capture antibody and the detector antibody, which was enzyme linked. Okay. Then we had your competitive ELISA. Competitive ELISA, less color, that means more antigen present. Okay, same thing which I had explained till now. Then we had your capture ELISA. In capture ELISA, what I was doing, I was trying to find IgM antibody in the patient's serum sample. Okay, now don't get confused by saying this. Why is this so huge? Because IgM is pentameric in nature. Okay, it is pentameric. That's why it is five. It has 5 antibody molecule attached. Clear? So what was happening here? We capture the patient's IgM antibody first on your anti-human IgM and then detect by adding a recombinant antigen followed by a enzyme labeled antibody. Okay, clear? These are your types of ELISA. Now, what are the use of ELISA? ELISA can be used for antigen detection, for hepatitis B for serum markers, HBS antigen, HBe antigen, NS1 antigen for dengue and rotavirus. ELISA can also be used for detecting antibody against the same hepatitis B, hepatitis C, HIV, dengue, rotavirus, toxoplasmosis and leishmaniasis. This was everything about ELISA. Thank you.